What we're going to talk about today is balancing our hormones. A question that so many ask is how can they balance their hormones naturally? And the reason I want to ask Dr. Angie is because not only is she a GI specialist, but she also specializes in weight loss. So Angie, maybe you could share 2 or 3 tips for us who are trying to balance our hormones.
Absolutely. You know, what I call the trifecta of health is eating a great nutrition, like a whole food plant-based diet, but also exercise, but don't minimize the power of hormone optimization. You see, if you have a Ferrari, okay, and you don't put the right fuel in it, it's not going to be able to go as fast as you want it to go. So it's the same thing with the human body. If your hormones are not balanced, your energy producing hormones are basically tanked out. It's very difficult to lose weight. So your all your efforts as far as watching your calories, working out, they just don't pay off, and then you can get really down and depressed and feel like you're just running your reels. So whenever you are trying to lose weight, if you have fatigue, hair loss, dry skin, insomnia, heavy menstrual cycles, again, I can't emphasize fatigue, abnormal weight gain, all of those symptoms that may suggest that you have a hormonal imbalance, I would suggest seeking help from an anti-aging doctor or an age management doctor, somebody who specializes in that, because they will be able to help you optimize your hormones with natural hormones, bioidentical hormones, instead of the chemical hormones, which could be carcinogenic. And that can give you fuel to be able to stay, to get results from all the efforts that you're putting in at the gym or with your nutrition.
That makes a lot of sense. So not to go to any doctor, but an anti-aging, what's it called?
Anti-aging or age management doctor.
Okay.
Yes.
And they could specialize that. And they will give you hormones that match your own, that are not synthetic.
That's correct. They're called bioidentical because they basically resemble your own natural hormones in your body. For example, there are estrogen and progesterone medications or thyroid medications that are very, very pretty much identical to your own hormones. But unfortunately, some of the non-age management or non-anti-aging doctors, what they use is the chemicalized pharmaceutical grade. And some of these hormones are so unnatural that they cause breast cancer, or they're linked to all kinds of problems. So if there's no risk so far as up until now, we have not seen any cancers that have come about as the result of using bioidentical hormones. So they're relatively safe, and it makes sense. Even though we don't have double-blinded controlled trials, it makes sense that a plant-based hormone is much safer than something that comes from a cow or a horse's urine. So it just, or made in the laboratory.
That is pretty logical.
Yes.
What about superfoods? Do you suggest taking any? I hear about ashwagandha and maca and all of these superfoods. Do you suggest those as well, or are they just not as powerful?
They're not as powerful. I get postmenopausal women in my clinic. Their estrogen, progesterone is gone, zero, and they don't have that. The ovaries are gone, right? So it's just almost impossible to get the levels to a more youthful level with the natural herbs. You need concentrated hormones. So the best way to go about it is to see a doctor who can write prescriptions for these natural hormones at doses that are that resemble your youthful levels. For example, when I see a menopausal woman, I don't want their progesterone to be at that level. I want to take it back to when they were 30 or 40, or 25. It just depends. But yeah, exactly. So these medications are not powerful. But you don't necessarily have to be in menopause, right? You could be perimenopause, or you're basically in your 30s and you have progesterone deficiency. Some of these natural remedies can be helpful. I mean, you can try it, but if you're not getting the results that you want, it's best to just seek help, get your levels checked, and then appropriately get treated.
So see a quality professional.
Exactly.
And I'm going to put Angie's information on the bottom of this video, so that's really helpful. Thank you so much.
My pleasure.